Hi everyone. My name's Joe Carter. I apologize for my scratchy voice. I think have a little cold, and I apologize for the webcam. I have a very old laptop. I'm surprised it's even working. My name's Joe. I'm a fifth-year grad student here at Mercyhurst University, and today I'm going to be lecturing on eosinophilic esophagitis, which is a immune disease of the esophagus. I actually personally have this, so that's my connection to this disease. So getting started, intro it. So EOE is a chronic immune condition of the esophagus. Chronic means it persists for a long time. It's always around. It doesn't really go away. The disease itself is a large buildup of white blood cells called eosinophils that build up in the esophagus itself. The esophagus is the tube, as you can see in the picture, that runs from your throat all the way down to the beginning of your stomach. The buildup causes the inflammation, as I said, and these eosinophils that build up release substances into the tissue, which causes this inflammation. And the eosinophils are actually not supposed to be found in the esophagus, which is where these issues come in. So some of these symptoms of EOE. I don't have all these. I have probably half of them on a daily basis. But some of these symptoms include difficulty swallowing, food impaction, which food impaction is when food gets stuck in your esophagus, so it's below the breathing tube, so you can still breathe, but it is end up getting stuck somewhere down here, and that causes some issues and some pain. Food refusal, and when we're discussing food refusal, we're talking about very, very young children. That it's common in children, and it's common in children, and these young children refuse to eat because they're so uncomfortable and so much pain that they just refuse to eat. Heartburn, chest pains, like I talked about earlier a little bit. Regurgitation, which is when you're eating and kind of drinking, have your meal, and you end up regurgitating it back up. So it's similar to vomiting, except obviously it's stomach bile too coming straight from your stomach. Food regurgitation is when it doesn't make it to the stomach, it's somewhere in your esophagus and it flips around and pops back out. Not everyone with EOE has all these symptoms, like I said, and these symptoms can vary from mild to extremely uncomfortable. But these are some of them. EOE in itself is not life-threatening, but some of these symptoms can lead to life issues, like difficulty swallowing. You could choke, especially young children. There are complications where it could be not necessarily the cause of death, but some of these symptoms can lead to issues. So some causes of EOE. So one of the main causes of EOE is the reaction in the esophagus, which causes the eosinophils to build up. This reaction is caused by contact with food mainly, which causes the immune system to kick in and produces the eosinophils in the esophagus where they shouldn't be. The main cause is food. There's certain foods that have a higher chance of being the cause. For me personally, some of the foods that causes this buildup are eggs, nuts. There's a lot of them. Mustard, catfish. It varies in persons. Another very normal one is dairy. Thankfully for me, it's not dairy because I love cheese and love milk. So I would have some issues if it was dairy. But like I said, for me, it's egg. What's very interesting, it's a little fun fact. It's very odd because not a lot of things have egg in it, but not everything causes discomfort. For me, it's very obvious when there's a lot of egg and stuff, or mustard. Like for example, certain salad dressings that have mustard seed in it really screw with my throat. Mayo really screws with my throat. Mayonnaise, straight egg really screws with my throat. But like pasta has egg in it, no problem. Breading on chicken with the egg wash, no problem. It's very interesting. Anyway, so as I said, the reaction occurs, which causes the buildup, and then these eosinophils multiply and continue to build up and up and up until your esophagus feels very constricted. It causes a lot of inflammation. It's hurt. It burns. It's just all together very unpleasant. So the testing and diagnosis of EOE. Children with EOE have a higher rate of atopy than without. So atopy is someone who has one or more allergic disorders going on at the same time. So like for example, I have asthma and allergies and EOE. So children that have EOE a lot of times also have other things compounded on top of it, like which obviously causes some issues. And that's why when we're testing and diagnosing for EOE, one of the first tests that get ran are called a prick test. And these prick skin tests they test for different allergies and food and environmental factors that go on. They prick you up your arm. They do a bunch of rows, and whatever those little bumps start popping up, that's when they know that's an allergic reaction to it. So they'll prick the skin test to kind of find out specifically what foods that are going to cause issues. As I said earlier, for me, it's egg, catfish, and mustard are three big ones. When they're diagnosing children before they do this prick test, it's really up to the parents to notice some of the symptoms we talked about: the excessive vomiting, the food refusal. It's difficult for children to obviously speak up on their own because they may not necessarily know what is normal and not normal. For example, myself personally, I always drank a lot of water while I was eating. I always had difficulty swallowing. I eat very quickly. I don't chew my food all the way. Always had a lot of issues swallowing. I thought that was normal. I thought it was normal to have 4 cups of water with every meal. Obviously, it's not normal because of the situation where, kind of what I talked about in the interview when you guys go watch that, how I ended up getting diagnosed with it was down the road at 16 years old. So for 16 years, I was just drinking a ton of water over and over through all my meals, not knowing that that was abnormal, not knowing that that was not something that everyone did. Moving on, in adults, difficulty swallowing ends up being the most common symptom that pops up. It can kind of like, I wasn't an adult yet, but kind of like my story where you don't really notice it until it really starts happening, and then something bad happens. You're like, oh, that's not good. To confirm that someone has EOE, they'll end up doing an upper endoscopy and a biopsy are both needed. So, I'm sorry, I lost my train of thought. I apologize, everyone. The upper endoscopy is a procedure where a doctor uses a very thin tube with a light and a camera at the end of it, and you get put to sleep, and they put the tube down your esophagus all the way down, and they just can keep taking pictures as they're moving down the esophagus and down the entire upper digestive tract. A lot, as you can see here on this picture, that's a picture of the esophagus on the slide. Unfortunately, it's not my own pictures. I was trying to look for them. I couldn't find them. But a lot of times someone who has EOE will have esophageal rings, which are those striations that you can see that are present in a person with EOE that's caused by the esophageal damage from just the buildup of eosinophils. And a normal person's esophagus does not look that striated. Everyone has a little bit, but it's never that much to that magnitude as you can see here. Another thing that can pop up through these pictures are this white plaque, which is essentially just very large buildups of the eosinophils. You literally will be able to see them. I couldn't find a great picture of them, but you'll be able to see all of those. That's the upper endoscopy. So then you do a biopsy. So a biopsy is taking a small sample of your esophagus. Literally, they cut out a little sample of your esophagus, and they can measure exactly how many eosinophils per HPF are present in that sample. Anything over 15 eosinophils per 1 HPF means the patient's EOE. That's the most common way to diagnose it, and that's the test that's 100% what, without a doubt, can tell you whether the person has EOE or not. A little interesting statistic, going back to kind of what we were talking about earlier, is according to Dr. Delano and Lycoris, who did a couple studies on this, from 2014, 30 to 50% of children with EOE also have asthma or allergies, which is very interesting. I obviously fall into that 50%, but just an interesting little statistic for everybody. So treatments of EOE. The first 2 treatments listed are directly from the American Academy of Allergy, Asthma, and Immunology. So based on the skin prick test that we kind of talked about earlier, based on the results of these tests, certain foods can be removed from your diet in the hope to eliminate symptoms and lower the eosinophil count. So for me, when I got my skin prick test done, we found the foods. So we tried to eliminate as much egg, mustard, catfish, and tree nuts from my diet as possible. For me personally, that didn't work, but for some people, it works very well. It just kind of depends on the person, and that'll move it into the third treatment plan. But the second treatment plan is the empiric elimination diets. So doctors opt into this to eliminate major food allergens: dairy, eggs, wheat, tree nuts, and fish from the diet. they'll slowly add these items back in until the actual cause is discovered. I'm not entirely sure why you would do this one versus the food test. Based on what I kind of saw and read, it was a lot of times the skin prick test might not come back with anything, and it might look like you're not allergic to anything. So that's why you would do the empiric elimination diets, is so you get all the big ones, the top 5 or 6 that cause, eliminate all of them, and then slowly add them back in and keep taking tests, keep taking biopsies until it's apparent exactly which one it is. So this third treatment method the information on this method comes directly from the article written by Doctors Delan and Lycoris, corticosteroids. So this is the treatment plan that I personally use to tackle EOE. So corticosteroids have been shown to reduce tissue inflammation and eosinophil counts in patients with EOE. So there's 2 main types of corticosteroids, systemic and topical. So some examples of systemic corticosteroids are prednisone and methylprednisone. So they rapidly resolve the symptoms of EOE, but these tests have shown that these steroids, the systems that are taking these steroids regularly reoccur and come back. The EOE comes back quickly, which is obviously no good. So these steroids are used and reserved for smaller children who have very serious symptoms that they need to improve now very rapidly, and then just need to get done quicker. So that's where the systemic corticosteroids come into play. So the topical corticosteroids are more commonly used to fight EOE, and these are the steroids that I personally am on. Budesonide, I showed a picture of it right there. Corticosteroids are delivered orally directly through the esophagus using a liquid form. Budesonide is delivered in the slurry mix, which is created mixing with either maple syrup, honey, or Splenda. I can tell you from experience, it sucks. It's gross, but you got to do what you got to do. You mix it with 5 packs of Splenda. You get it into a little slurry. You drink it. You can't eat or drink anything for about half an hour. It coats it. It is an immunosuppressant, this kind of steroid, and it helps shut down the immune system from making these eosinophils. So unfortunately right now there's no cure for EOE that we know of, but the symptoms can be managed and it can be fought off. So the 2 current research articles that I picked, that's kind of going over some of the current research going on. So right now there's an emerging diagnostic method that there's a study of 200 adults that deal with EOE that have been on the treatment, that maybe have gotten rid of some symptoms and maybe some of them started to come back. But anyway, this study indicated that the longer the duration of the untreated EOE goes on, it's associated with a higher amount of tissue buildup in the esophagus. Seems pretty obvious, right? But all this is saying is, so let's say an adult's diagnosed at a younger age, and then they kind of take care of it. There's no more EOE, right? There's no eosinophils for however many biopsies in a row. You feel great, no big deal, no issue. Some doctors may have to take them off a steroid, right? So this study is just indicating that the longer time that it goes untreated, the larger the buildup is, but it actually compounds. It gets worse and worse and worse and worse. And the patients that went longer without treatment had a higher number of eosinophils, and it actually led to a lot more damage to the esophagus, and sometimes permanent damage, which is no good. The study also shows the interesting part that remission is possible and prevalent in adults, and this is not something you can kick. It comes back. Like I said, there's no cure, and that you need to maintain fighting the symptoms even after they disappear. So the second current research article. This study was conducted on the efficacy of budesonide, which is a corticosteroid that we talked about. So 3 total randomized controlled trials of budesonide versus placebo were ran. 2 on children, 1 on adult. In these studies, all 3 of them indicated that budesonide decreased the number of eosinophils present by a lot, and the study also indicated, this is the interesting part, that a budesonide tablet actually works similar to a placebo, and that the slurry mix of the topical just was way better than using, that the topical liquid was way better than using the tablet. So all this is saying is that, like we kind of talked about, that the topical is better for longer results than the systemic corticosteroids. Here's my literature cited. Here's some of the medical terms that were used. Thank you guys for listening. I appreciate it. Like I said, go check out my interview. I kind of go into more detail about my own personal story with EOE, and I hope you guys learned a lot about EOE. Thanks and have a great night.